Hi everybody, today is World International Women's Day. So this is going out to all of you women out there. We just wanted to share some fantastic stuff that is coming out of research that tells you what you need to look out for as early signs of diabetes and heart attacks. Now, it would seem like common sense that men and women must both get the same sort of signs or symptoms, which tell you early on whether you're going to get diabetes or whether you're coming up for a heart attack. But that isn't strictly the case. And that's why we wanted to let you know certain signs and symptoms that can let a woman know that she is coming up for diabetes. And we've got all the information that's in this video and more of that, and a complete listing of all of those early symptoms of diabetes in the article that's linked to this particular video. And there's going to be a link to that just above the video, so do make sure you go in there and take a look at it. But here's one of the early signs that I bet none of us really look at or know. So when there is a darkening of skin, usually in the folds of the neck or in the armpits or in the groin area or in the hands, right? So in the knuckles and places like that, that could be the first signs that your body is actually becoming resistant to insulin. Now, we all think that this is just a cosmetic thing, right? So we try skin whitening creams, we try to clean it up properly, we use a scrub, but it may well be a deeper sign that your body is actually insulin resistant and that it is going towards diabetes. So if that happens, do get a blood test. A simple fasting blood sugar is even fine to begin with. So just get that and you will know for real whether you're approaching diabetes. That's the first sort of unique sign that women often ignore about diabetes because they simply don't know. The other sign is again something that every woman knows about, and it's about irregular or painful periods. Now, it isn't the case that every time you have irregular periods or if you have painful periods, that's just a sign that you are getting diabetes. No. But there is a certain syndrome called PCOS or polycystic ovary syndrome. And many women know about this because their doctors tell them about it. So if you have irregular or painful periods and you know that you've been told that you have something called PCOS or polycystic ovary syndrome, that's again been linked deeply to diabetes, to insulin resistance and the possibility that you could get diabetes in the future. So if again that's something that's happening to you, you should make sure that you get a test and check and make sure that you aren't diabetes. You're not already diabetic, or you're not on the verge of actually getting diabetes. The other signs and symptoms for diabetes are something that are common between both men and women. So if you feel too thirsty all the time, you're using the washroom all the time, you feel unusually fatigued or tired, these could all be signs that you are approaching diabetes or you're already pre-diabetic. Now, the term pre-diabetic is a recent invention, and the reason that doctors came up with this term is because doctors realized that the current standard for diagnosing diabetes is that your fasting blood sugar needs to be 126 or higher. But when they did the research, they found that when they looked at women who had blood sugar levels, fasting blood sugar levels of 100 or more, the damage that is done by diabetes to the inner organs, to all of our blood vessels, was already taking place. And because of this, the standard for pre-diabetes was determined, and we said that any blood sugar level fasting between 100 to 126 would be classified as pre-diabetes, which means this is a wake-up sign. You need to take care of it. You need to look at your diet. You need to exercise. You need to do all the things that can reverse pre-diabetes. And that's the most important message in this video. Pre-diabetes and diabetes can both be reversed. So women, please do look at the article that's related to this video. Look at the list of signs that your body may be giving you that you are headed for diabetes, and you can reverse it even before it starts. Here's another reason why it's particularly important for women. Nature has somehow built women to have a natural sort of guard against heart disease. That's why you hear a lot more men get heart disease than women get heart disease. It has to do with the hormones, the reproductive cycle, the way cholesterol is handled in a woman's body, several things. But here's what happens when a woman gets diabetes. As soon as a woman gets diabetes, her risk of getting heart disease goes up by a factor of 4 to 6, which means that you are 4 or 6 times more likely than any non-diabetic woman to actually get heart disease. Now for men, when they get diabetes, that risk goes up only by 2 to 3 times. So it's like a double whammy. If you ignore the early signs of diabetes and you actually end up getting diabetes, you've also increased your risk for heart disease by a factor of 4 to 6. You certainly don't want that. Speaking of heart disease, that's the second important message we wanted to give out today on World Women's Day. And that is, the signs of a heart attack are different in women and in men. So the classic signs of a heart attack in a man are, profuse sweating, feeling pain in the chest, there's, pain that radiates down your arm, and all of those things are what, men go through when they're going through a heart attack. Here's the interesting bit of information, that women never go through any of these classic signs. Most often, women feel only a sense of nausea and a feeling of jaw pain. And because none of these symptoms are actually taught to women as being early signs of a heart attack, women don't get care for a heart attack immediately after the event, and that leads to much poorer recovery rates, and the outcomes are not good for women after a heart attack compared to the outcomes for a man. Because as soon as you see somebody holding their chest, you think that's a heart attack, you rush them to hospital, they get emergency care, and naturally the outcomes are so much better. With women, because all that you're feeling is jaw pain or nausea, you may just miss the fact that you had a heart attack, so nobody gets you to ER in time, and you really don't get the sort of care that you need in order to bounce back. And therefore, it's very important for women to know and to recognize these signs. Here's the other thing that happens. So there was a research study that was done in which people interviewed women who had had heart attack, and they interviewed them and asked them for signs and symptoms that they began to feel 1 month before the heart attack. Now imagine the number one symptom that was common with all these women. It was simple feeling of fatigue, of being run down or having a flu. Now how many times have you as a woman ignored the fact that you're feeling really run down for an unusually long period of time? You put it down to that time of the month, or you tell yourself it's your thyroid, when actually it could be the first sign that there is a heart attack approaching. Here's the second most common sign that all of these women reported before having the heart attack, in the month before the heart attack. That was sleep disturbance. And here's another one that I'm sure none of us really thought about, and that is indigestion. So these are the unique signs that women often feel in the month before they're actually going to have a heart attack. And that's pretty scary, right? But it's really useful information. So if you know anybody who's going through any of these signs, just share this video, share the information. We'll put a link to the post that gives detailed symptoms of early signs of heart attack or an impending heart attack in women. We're going to put that in a separate link just above this post. So go ahead and take a look at that as well and share it with as many people as you can. So that's our message from Sepalika to you. We'll keep bringing you, information that's coming from research, from science, information that you can use to both prevent these sorts of illnesses, diabetes and heart attacks, and to get immediate care, because you know exactly how to sort of, know the early signs and symptoms. So pass it on to everybody you can. Let's check if there are any questions. We'll take them as we go. All right, what's the first question? Okay, we've got something that says, all right, so do women actually get a higher cardiac risk after menopause, or do they get a greater risk of diabetes? And yes, the answer is that around menopause, the hormonal systems in women's bodies undergo a dramatic change, and that changes the way the body handles insulin. It changes the way the body handles several other enzymes. So your risks of diabetes certainly go up around menopause, so you should be extra careful, and the same goes for cardiac disease as well. This isn't meant to alarm anybody, but it's just to make sure that you get the regular tests and you know exactly what's happening. So I don't think there are any other questions. Go ahead please and put in your questions. under this video, and we'll make sure we get back to you. We'll answer all of those questions, and keep tuning into Sepalika for more information that you can use. And very happy Women's Day. Hang on. Oh, we do have another question. So if you have irregular periods, will you get diabetes? Well, the answer is not every irregular period is an early sign of diabetes, but if the irregular periods are happening because you have polycystic ovary syndrome or PCOS, then there is a high likelihood that you're already resistant to insulin. So you should get a blood test and make sure that you aren't already in the early stages of diabetes, and get the care needed. We've got a ton of resources on sepalika.com on how you can reverse pre-diabetes and diabetes through just simple lifestyle changes. Just a little bit of diet change, just the proper exercise, getting your sleep right. These things can make a huge difference. So even if you're somebody who's having irregular periods, or if you've got PCOS, just go ahead and get the test done and make those small changes, and you should see a huge difference. Okay. Do women have... What about vision? Okay, so yes. So one of the other early signs of diabetes in both men and women is when you get fuzzy vision, right? So diabetes is basically too much sugar in the blood. That kind of blood which is laden with sugar, when it gets into small blood vessels like the capillaries of our eyes, they can get damaged. They can damage the nerves of the eyes. And all of this can lead to fuzzy vision. So if you're getting fuzzy vision and your optometrist or your eye doctor doesn't feel that it's just a question of adjusting the power of your lenses, then you should certainly get a test and make sure that you aren't diabetic or pre-diabetic. Okay. Right. What's the other question? So women have less possibilities of getting heart attack than men. Yes. Until you don't get diabetes, women genetically, biologically have a lesser risk of heart disease. This is just the statistics. Have lesser chances of heart disease than men. But the minute a woman gets diabetes, she loses that kind of natural biological guard. So, the chances of getting heart disease go up by a factor of 4 to 5. Okay, I am 37. Diabetic, hypothyroidism, and hyperlipidemia. What can I do to heal myself? So yes, diabetes is kind of not just in allopathic medicine, everywhere, even in traditional medicine, we know that diabetes is a carrier of 100 ills. And that is because diabetes takes sugar-laden blood to every single part of the body. And wherever there's too much sugar in the blood, and whatever organ it touches, that organ is going to be damaged. And that's the reason why fixing the diabetes is the first step to handling these other problems. So hyperlipidemia means not having proper cholesterol numbers. Hypothyroidism means your thyroid gland's not working well. So there are resources specific to each of these chronic disorders on Sepalika. So Sepalika is all about helping people to deal with chronic disease with the least of medication possible, and with the right lifestyle changes and dietary supplements, helping you reverse chronic disease. It is possible. There are people who have turned their lives around 360 degrees, and yes, it is possible to reverse these diseases. So please look up those resources on hypothyroidism specifically, and on diabetes, and how you can work with your doctor to reverse diabetes. We're not advising you to go off the medication. Just be aware of what the medication is doing to your body, understand the side effects, take the research material on dietary supplements and exercise and all of the lifestyle changes to your doctor, and you can work out a plan that will actually help you to reverse your diabetes and these other chronic diseases. Let's see. What should a woman do when she has diabetes and she is diagnosed with ectopic pregnancy? Okay, all right. Now that's quite a complicated question. So ectopic pregnancy means a pregnancy where the fetus is growing in the fallopian tube rather than in the uterus. So the fallopian tubes, there are two tubes that come down into the uterus, and when the sperm and the egg have fertilized, the baby should ideally begin to grow in the uterus, which is what we call the womb in common language. But sometimes the fetus can begin to grow in the fallopian tube. and it's not advisable, sadly, to carry that fetus to term, which means the pregnancy may have to be terminated. This is a very specific question and something that a doctor can only answer after looking at the patient. But diabetes during pregnancy certainly complicates everything for both the mother and the child. So you should do everything to try and not get into that situation. We have a fantastic article that we've uploaded just today on gestational diabetes or diabetes during pregnancy. It helps you identify the early signs, tells you what you can do to actually make sure that it doesn't develop into full-blown diabetes. Because what you have to remember is a growing baby feeds off nourishment from the mother. If the mother has diabetes, that means too much sugar is going through the umbilical cord into the baby, and the baby is going to grow to a very large size. When a baby grows to an extremely large size, then there are going to be all kinds of difficulties to the mother during birth. It's going to be a very sort of difficult pregnancy, labor, childbirth. Everything gets quite complicated. So this particular question, I would suggest the questioner to please go to a doctor and make sure that you get specific advice. But other than that, we've got resources on gestational diabetes. Everybody can look at them. I think that's about the questions and the time we have today. So have a fantastic Women's Day. Make sure every day is Women's Day by just being aware of your health and using the resources that we have to stay healthy and to always be in vibrant health. Thank you so much for tuning in.